Around 2010, when I was about to finalize my university degree, I was having a discussion with a lecturer who specialized in the area of microbiology and microscience. And we were having a discussion. And my discussion that I was having with this lecturer was, why is it that when a person goes for a blood test, a nurse or whoever is conducting the blood test, why is it that they take so much blood? I never understood it. Why? I recall a time whereby I went for a blood test and my doctor referred me to the hospital to do a blood test. And when I arrived at the hospital, I went to the unit where they conduct the tests, and the lady came with 4 or 5 syringes. Syringe is what they used to draw the blood with the needle. When the lady came with 4 or 5 syringes, in my head I was like, if you need my blood just to test for, let's say, to make sure my kidney is working properly, why do you need 4 or 5 syringes? Doesn't make any sense. Do they need that much blood to check if someone's kidney is working properly, or if someone's liver is working properly, or if there is a disease in that person's body? Do they need that much blood? I always ask that question, and I don't think the lecturer was able to give me a definitive answer. However, the lecturer was saying they do need a decent amount or quantity of blood to carry out tests in the lab. I understand that. If I want to check the DNA of someone, let's say on a crime scene and the police, they are investigating, a single drop of blood can link them, can solve that crime. They don't need a certain amount of blood to be able to tell, oh, this is the person who committed the crime. Just a small drop of the blood. And there have been several cases within that region that were able to determine who committed the offense. What I know is a single drop of blood, because now there are much advanced technology like micro sample technology, where you can just get a device, take a small pinch of blood from you, and it could determine straight away what is wrong with you. There are more advanced technology. Why is it that so much blood are still being collected by hospitals? Do they need that much amount of blood to be able to determine a particular illness or disease, or if something is not functioning properly in someone's body? I decided to do some research. Once a small syringe contains about 57 drops of blood. A small syringe, not a longer one. Most of the times when I've gone for a blood test, they use the long syringe. So that long syringe might have maybe 50 drops of blood or 60 drops of blood. Do you need that much to be able to conduct a test? Because from my understanding, a single drop or few drops of blood should be enough to carry out a test. Unless maybe there is somebody who is more experienced in this field and can explain why X amount of blood is required in order for a nurse to conduct tests and to determine or find the root causes of someone's health or problem. Because another way I'm looking at it is if someone is terminally ill and you have to conduct tests on them, a terminally ill person requires lots of blood to stay alive. And you cannot draw that much blood to go and conduct tests to be able to determine or find out how much time they have. Rather, taking blood of 4 or 5 syringes from someone who is terminally ill could definitely reduce the number of time that they have left. Maybe the way I'm looking at it, and maybe I'm not looking at it from the right angle, but if somebody who's more experienced can give a better explanation, then I would look forward to that explanation. Does a nurse, a hospital, a clinic require so much blood to be able to conduct a test to determine if something is wrong with a patient or someone who is feeling unwell? Perhaps I'll get a clear answer. Please leave your answer below.